So as far as pain concerned, I can tell you as an anesthesiologist, I would have used parts of this plant both preoperatively and postoperatively. Number one, treat anxiety, and which leads to inflammation, which leads to increased, complications after an anesthetic and surgery. And then postoperatively, once again, for anxiety, inflammation, and hopefully to keep them off as much of the opiates as possible. Now, cannabis happens to work in several ways on those CB1, CB2 receptors. And once again, you have them in the brain, you have them on the peripheral nerve cells and the peripheral tissues, and they work to decrease the pain. And so we know that cannabis can help with inflammation, number one, but it also decreased the signaling along that pain pathway. Now, what's interesting is, and what most healthcare providers don't understand, they don't understand the physiology, is that cannabis plus the opiates work synergistically. They don't work, as additive to each other. There's very few cannabinoid receptors in the cardiorespiratory center of the brain. So you're not going to get cardiorespiratory center depression, but what you will get, they work synergistically. And in fact, the cannabinoids will work on those opiate receptors to increase the endogenous opiate release in the body. So it sort of helps to underscore what the opiates are doing. So we can get patients down to a quarter of what opiates they've ever used by adding cannabis to their regimens, and it does work on the brain, neuroplasticity, neuroinflammation, all those things, preventing a certain, what we call sensitizer and activators that add to inflammation and pain. It's going to decrease all of that. So as a physician, as an anesthesiologist, this would be a great study for anesthesiologists to do, to see indeed if they can decrease opiate use and the recovery period after anesthetic, because we do know the effects that it has on the peripheral nerves and the tissues and in the brain pathways.
Yeah, you being an anesthesiologist, a lot of patients we've worked with over the years that are going into pre and post-op, their doctor, and I'm assuming because they don't know much about the cannabis plant, they're saying get off of any of your cannabis medicine up to 2 weeks prior to any surgery. Can you add to that?
Yeah, I see the plus side and both sides of that coin. Number one, I as an anesthesiologist would love to see the study of their using it preoperatively, because we put patients on blood thinners preoperatively, so that we don't have the clotting issues, or you can use cannabis products to do the same thing. Mm-hmm. And it's our job as anesthesiologists, oftentimes we're taking care of patients with, a list of medications. And it's our job to handle that situation and get a patient through an anesthetic safely. Cannabis would be no different. And in fact, it's less harmful than many of the medications we see patients on. So as anesthesiologists, we should not fear that. If anything, I would use that, and I would love to see a study designed with that. But with that being said, we do know, and this is the worry I have with all the CBD products coming out. People are using CBD. They're not using it with instruction or direction. They're taking large amounts of CBD. CBD will tie up the enzyme system in the liver, the very system that metabolizes the pharmaceutical drugs, particularly things like warfarin or anti-epileptic drugs. So they're using the same system to metabolize drug, can be tied up by CBD, more so than THC. THC as well, but not as much as CBD. I mean, it's the same reason we tell elderly people not to take grapefruit with their medications, because it will tie up that cytochrome P450 system. So you can expect or anticipate maybe seeing higher blood levels of their pharmaceuticals that can be toxic to them.
Yeah.
So we want physicians, healthcare providers, and certainly anesthesiologists to really understand the physiology, the interplay that these products can have. But once again, we're seeing patients that are using these products without direction. And there's a difference with using direction and without direction.
And direction is needed.